Hello everyone, my name is Aban Gautam. I'm a general practitioner based in Nepal. Uh, the devastating earthquake hit Nepal in 2015, which prompted me to found a non-profit organization called Heart Nepal, which is dedicated to bringing disaster relief and free medical support to the victims and communities in rural, remote areas of Nepal. In this session, I'll be sharing my experiences of crisis management following the major earthquake. Talking about my country, Nepal, it is a landlocked country with a population of 37 million. It is located in South Asia. It shares a territorial border between China and India. Nepal is also known for its iconic Himalayas, particularly Mount Everest. The 2015 Nepal earthquake killed nearly 9,000 people and 600,000 structures were damaged, amounting to half the country's GDP. Two of the major earthquake of 7.8 and 7.6 Richter scale and hundreds of aftershocks caused thousands of people displaced for a prolonged period of time in temporary shelters, and also because 90% of the health-related infrastructure were damaged in rural areas, it greatly increased the risk of communicable diseases in the temporary shelters. Uh, so in this session, I'll be talking about three takeaways. These are building and working with teams in fight, hidden health problems following a disaster, and tackling challenges in response programs. I hope this session will be very fruitful to you and help you in responding to similar emergencies in the future. Now I'm going to move on to the day when the earthquake occurred. It was 25th April midday on Saturday when we felt the earthquake. I was at the hospital accommodation off duty, and all of our colleagues, we ran outside to an open space. It was very stressful because it was the most powerful earthquake that we experienced, and it continued for a while. I tried to contact my parents, but the phone were not working. After 1.5 hours, it was settled, and me and my friends we rushed to the hospital, and there we saw lots of patients from the ward were lying on the floor and car parks and garden. Many injured people were rushed to the hospitals. Although we were off work, we offered our service. Initially, we didn't knew what we should be doing as there were no protocols. So we started looking for wounded patients and ended up doing wound care. The hospital supplies quickly ran off, and then we realized that we had to save every bit of gauzes or antiseptic solutions to help more patients. The hospital beds were full and the patient laid on the floor. At times, we performed certain procedures such as wound suturing at the same site where patients were lying. There were no possibility of transfer to an aseptic rooms. We continually looked after all the patients until midnight, and by the next day, the tents were put off, to provide extra beds to those who required continuous monitoring. Um, Talking about in the country, the consequence of the earthquake forced thousands of people to flee their destroyed homes and shelters in temporary camps. Because 90% of the health related infrastructure were damaged and people were disconnected from the health services. And since they were living in temporary shelters, there was risk of communicable diseases due to poor sanitation, hygiene, and overcrowding. My organization was not prepared for the earthquake because it did not exist at that time. The initiative to found the organization came when I started to get involved with local organizations for medical relief programs. I realized that people living in rural areas were in desperate need of help. Therefore, I sat together with few of my colleagues who were working in various hospitals in Kathmandu and discussed possibilities of doing something from our side. People who showed interest or motivated to dedicate the time for volunteering were united under the non-profit banner of Mountain Heart Nepal. At that time, every task of outreach clinic was a mission for us, which began by first identifying our day off where we could deploy, and then I assigned responsibilities to the members in the team. The responsibilities included uh, looking at the communities, which required immediate help, or by evaluating severity and pathology. Uh, or the responsibilities also included, like, to collect resources, recruit additional volunteers, or to contact the local community leaders or community members or women's group to encourage spreading the word of outreach clinic in advance. The outreach clinics were independently organized by Mountain Heart, but there were lots of collaboration with local partners, other NGOs for resources. And just for collaboration among organizations for resources, we gave the name to our group as Mountain Heart Nepal, and we continued our response initially without registration as a formal non-profit, but later on ended up registering it as a non-profit organization after 6 months. So we continued our outreach after the earthquake, and with bit of flexibility, we adapted our organization to evolving problems. Initially, our aim was to provide medical aid in rural, remote areas because, uh, as mentioned earlier, 90% of the health facilities were destroyed and people were disconnected for a prolonged period of time from the health services. And since most families were living in temporary shelters, there was also risk of communicable diseases, and which could only have been addressed through mobile health clinics by bringing doctors at the doorstep. But later we realized that many people have had difficulty time processing the events and resuming their normal day-to-day activities. Medicine wasn't going to help them alone. For instance, most feared going inside their homes. They had problems of sleep and eating, and most children they did not want to go to the school. Therefore, we modified our existing plan and added few services in our clinic to provide holistic support to the people. This included music, arts, and dance therapy, which helped people to address their psycho-social issues and celebrate the joy of being alive. It also helped individual, experiencing emotional and psychological challenges to achieve personal well-being and improved level of function. Because schools were closed for quite a long time, therefore, to bring the excitement and joy of reading, we mobilized non-medical volunteers in our clinic to also set up a mini library so that school children got engaged with the books while they were waiting for consultation with the doctor. As well as we brought acupuncturists in our clinic to address an alternative way of treating chronic pain that usually exacerbated following post-earthquake. And people, they got a different form of treatment beside medicine. So that was really helpful. Uh, we were brand new, untested doctor in the middle of tremendous human and structural disaster. Every medical camp was a mission, and there was lots of challenges in front of us. Somehow, we always managed to find a way to solve it through our teamwork. We had issues of finances and resources. As being a new young organization, we are not able to receive support to continue our work. But with a bit of determination, we were able to bring essential resources and expertise from various local organizations, or by asking for help through social media to where it mattered the most. Another important issue was time management. This is because most of my colleagues, including me, were recent graduates working full time at various hospitals in Kathmandu. And therefore, we were only allowed to take fixed amount of leave every month. And I handle time management and remoteness issue by planning ahead and traveling halfway after the end of hospital shifts to conduct outreach clinics during our day off. And a great example of determination to achieve something that is unrealistic can be explained by our dedication to get helicopters for our medical mission. During the earthquake, World Food Program were operating in Nepal to provide food and shelter support to the earthquake victims in remote communities. So we thought we need to approach them and see if they were happy to provide helicopters for us to reach the most remote communities for medical camp. They were quite reluctant at first, and they said these helicopters are for food supplies and have not been used for any medical missions for any organization outside theirs. But with constant approach and talks, they finally agreed to sponsor for helicopter. Hence, with right vision, right team, and right people, and people we meet, everything is possible. As mentioned earlier, as a novice, I engaged and directed the team to initially provide medical treatment to the victims of earthquake in 2015. During these times, I developed an innovative strategy aimed to provide holistic care to the victims by not only managing trauma cases and acute and chronic condition, but also by focusing on wide range of problems such as health education, psychological support, and prevention tactics. So we continued our medical camp in earthquake affected districts for 2 years as rebuilding was slow and people remained displaced in temporary camps for a prolonged period of time. Therefore, we couldn't stop ourselves from carrying out our activity during those times. With my transformational leadership ability, I was able to inspire others to join my cause and maintain a dedicated team of medical volunteer pool of around 400 healthcare professionals. As we grew along, who were ready to deploy at a movement, noticed, and public health emergencies. Like it is said that leadership never stops, and we are evolving in addressing varieties of health problems in Nepal. In these experiences, I have established a very high bar in achieving my work and the work of improving the lives of others, demonstrating initiative, compassion, and creativity. Therefore, it is very essential for young people like us to dedicate our time to help people in need. So now we are also building our own hospital, um, and we are also focusing on any kind of emergencies that occur in the country. In the past, we have been very active in responding to flooding that occur in Tarai region every year. And people in these vulnerable communities still lack access to healthcare or cannot afford for treatment. So our medical camp are a boon for them. So far, we have conducted more than 130 outreach clinics, and we have reached about 25 districts of Nepal, and more than 35,000 people have received free consultation and prescription refills from us. Uh, so in rural areas, we also realize our need for continuous supply of medications. So we have partnered with a US-based organization called Direct Relief since 2017 to help us with medical supplies. We procure them and we give it out to the health centers in rural areas so that there is constant supply of medicines beyond medical camps. So now we are also focusing on clinical research because we think it is a sustainable way of solving health challenges of Nepal. And we were lucky to get the funding last year. And we are, as mentioned earlier, like we are also building our own hospital. Um, so the initial funding for this hospital was supported by Direct Relief, and the hospital is under construction. So we are also looking for help from individual organizations for monetary support or support of equipment to the hospital so that we can do more. And we are also looking for volunteers to come and support our staff or patients. And we also want to learn from you. So please feel free to contact us or visit our website for more information. So I hope that was a very fruitful session, and teamwork was the key to our ability to help so many people even after the earthquake. The resilience, the strength, pride of our volunteers amazed and inspired us to continue our work even today. I think anybody can solve, and you don't need to have a first-hand experience or a college degree to solve. You may not need to know the theory in your mind. So I think you only need a heart full of praise, a team to provide direction, and a common goal to give something back to the community. Thank you for listening, and I hope that was fruitful, and look forward to answering your questions. Thank you. Namaste.